Hello, welcome to another episode of The Grapevine, right here in Orlando, Florida. I'm Susan Israel.
Susan Salib.
Susan Zambrano.
We have the three Susans again today. And we have a very special guest with us today. We have Dr. Sherry Girgis.
Hello.
Welcome, Sherry.
Welcome, ladies.
Dr. Sherry is a board-certified adult psychiatrist and is also a child psychiatrist. Thank you for being with us today.
Thank you for having me.
We're very excited.
Yes.
Thank
So today we're going to talk about something very important, depression. This is a three-part series on depression. This is part one. And depression is the state of mental illness. It is characterized by deep, long-lasting feelings of sadness or despair. Depression can change an individual's thinking, feeling, and also affect his or her behavior and sense of physical well-being. So depression is a big word these days. We, especially during the pandemic, pre, post, and it's been definitely talked about quite a bit. Mm-hmm. But as we know, depression has been, around since the beginning of time. So I think our first step here, Sherry, today, Dr. Sherry, is we'd like to understand what is depression? Can you give us some information on what is depression?
So basically, I think sometimes or commonly people misuse the term depression. So very often when someone is sad, feeling down or sad, having a bad moment or a bad day, they say, oh, I'm depressed. But actually, depression and sadness are not really equal. We can't say I'm depressed all the time. I can say I'm feeling down. I had a horrible day today, so I'm sad. I'm feeling sad. So sad is one of the emotions that we experience as human beings. However, sometimes sadness, if we're not paying attention and we have a lot of stressors, a lot of triggers, it may progress to become depression. And there are different kinds of depressive disorders.
Okay.
So what are some of the symptoms of major depressive disorder?
Yeah, so like I said, there are different kinds, you're right. So major depressive disorder is one of the common depressive disorders. It basically, to be classified as having major depressive disorder, you need to be sad or having depressed mood, and also or having lost complete joy in things that you typically enjoyed in life. So if you typically enjoy, going out with your friends, or typically enjoy going to church and stuff like that, you find yourself you no longer want to do that. You no longer want to see anyone. You have to ask yourself, okay, what other symptoms do I have, in order to be classified as having a major depressive episode. So I'm sorry, I'm repeating myself, or
no, you're fine.
Major depressive episodes, you need to have sadness or loss of joy, okay? And then at least 5 other symptoms. The symptoms, they may include, one of the main ones that become very disturbed is fluctuations in your sleep. So some people may tend to sleep a lot. Like they have difficulty waking up in the morning and they would rather just hide in their bed and stay all day in bed. That's a big sign of depression. Another disturbance could be trouble with falling asleep. So people could, stay up for hours, or they can fall asleep, but then they wake up every hour, Another disturbance could be a disturbance in appetite. The appetite could be an absolute loss, like you start losing a lot of weight and people are questioning you what's going on, versus eating a lot, binge eating, and it's like sometimes people use that as a way to comfort themselves.
So is it both kinds of appetites? Like either you're losing weight or you're overeating?
Correct.
And it's so interesting that it's like eating a lot or not eating at all, and then like sleeping a lot or not sleeping at all.
They're kind of the two extremes
Yeah,
then.
exactly. Just not normal, right? Like out of character,
You're
out
right.
of norm.
You're
Yeah.
right. So yeah, it's something that's out of the ordinary for the person or patient. And it's symptoms that will start to indicate a lot of dysfunctionality. So you become unable to cope with your daily chores, with your daily activities, going to work, studying, socializing. You notice that there's a difference, in your function, your daily
Really
function.
interesting.
It is.
Yeah, it's very interesting.
So I want to kind of stick a little bit to the to this type of major depressive disorder. Are the people who are suffering from it, are they able to recognize it, or is it someone else that recognizes it for them? Like this says, you've got something, or are they able to be like, there's something wrong with me, I need to go and seek help?
Very good question.
Or are they just completely oblivious?
The family sometimes and friends, if they're very
notice.
close to you
Yeah.
and very aware, they're starting to recognize that you're not the same. Why are you sleeping so much?
Right.
What else? What's going on? And then the person sometimes they might be in denial. They don't want to recognize that something is wrong.
That seems very common. It seems like they're shameful to say,
Yeah.
yeah, I do feel down or I am depressed.
Right.
Maybe easier to say like it's just a rough patch.
Right.
Yeah.
Like
Right.
I feel like I hear that a lot.
Yes.
That's true. That's true. A lot of people tend to not want to, they minimize, they downplay the symptoms.
Right.
That's probably the first step to healing, is to be self-aware about it and know that I do need to get help.
Correct.
That's very important. So,
Yeah.
It's like drugs, like being a drug addict and stuff.
yeah, it is an illness, right? Correct. It's something that it's like any other physical ailment that we have in our body that needs to be treated.
Absolutely.
So you treat adults and also children. Are you seeing are the kids able to recognize it at least, or do you find that the adults are better at recognizing they have it more than children?
What's interesting is that actually, so if I have a family that comes in with their child and they tell me the child is acting out, their behavior is just awful, it's not the same anymore. And I ask, well, does he seem to you like he's depressed or anxious? A lot of the times I find that parents say, no, he seems fine. I don't think he's depressed.
Right.
However, when I sit down with a child and talk to the child, and ask for more details, the child tells me, yeah, they are depressed. And that's a very good point, because the parents, even though they love the child, they're in tune with the child. However, the outside world cannot see what's on the inside of the child.
Right.
They can only see the externalizing behaviors we call, which is the acting out. However, the internalized symptoms are not really shown to the outside world or the parents.
So you obviously need a degree to really know this well, because someone like a parent, they'll see something is going on with their kid, but they don't even realize it's depression. They're just saying something's up. It's not necessarily a physical thing, but something's going on, and they would need a professional, obviously, to determine what it is or detect what it is.
And that's why it's important for parents to always ask, honey, are you okay? What's going on?
Yes.
I see that
In
you're
tune
not
with their
acting,
emotions.
right,
Yeah.
you're not acting the same.
Yeah.
Why are you so angry? So usually depression in kids can manifest itself in anger and irritability and acting out. In adults, it's a little different.
That's so interesting because you think oh, it's just the age. Like, how often do you hear that? Like,
Yes.
oh, that's just the age,
They're
like
being
hormones,
just
or
teenagers.
coming into teenage years,
Yeah.
But to your point, you can't gloss over it for sure, and you have to involve. And I think it's important, for somebody else, because as the parents, you're you want to discipline, you want to teach them the right way, but you're not addressing the underlying issue.
And the point is too is, parents would say, well, why is he depressed? He can't be depressed.
Yeah.
You know,
Right.
He has
There's no
issues.
reason.
They're
Yeah.
entitled to.
They think that there's no reason to
Yeah,
be. Yeah.
everything they ask for, they get. You know, no, he's not depressed. I don't think. I mean, he's lying or he's trying to get attention. No, I have to believe what the child is
Absolutely.
telling me, and the child
So important.
is not going to lie about feeling
No.
depressed or sad
not
most
at
of
all.
the time.
No.
You know.
Yeah. Now, Dr. Sherry, you touched on something that's really important. You said that there's 5 different factors,
Now
right?
you're bringing us back to
No, I can't get off of this one. That's why I'm like, wait, I have so many questions
Yeah.
just on this.
Oh, okay. Yeah, we
No,
can
go
we
for
can
it,
continue
yeah.
on the child stuff. Let's pertain it to the children stuff too. Do those 5 factors, how long do they need to last in adults and in children? Because you can have 1 or 2 of these factors or 1 or 2 of these symptoms maybe for 2 or 3 months. But how long do the 5 have to last in order to be characterized for children and adults? Since
So actually, we didn't discuss all the symptoms. So
Yeah.
can we back up a little? If you don't mind?
there's just so much that we want to learn.
Yes.
All right. So again, so for us to diagnose a major depressive episode, you need to have at least, like I said, 5 or more symptoms. And one has to be either sadness or the loss of joy, okay? And then we talked about the fluctuation in appetite, then fluctuation in sleep, then change in focus, okay? A lot of the times, people come to me and say, I have ADHD, I cannot focus. You know, it happens a lot. And then I, ask, well, tell me about your mood first. I always start with the mood because, again, people are usually in denial.
Yes.
They don't want to accept the fact that my mood is off. So when I go into the mood, sure enough, they've been sad or been stressed. And, in both situations, a lot of anxiety or depression can cause a change in focus and decrease in cognitive, focus. So change in focus is one, okay? And then also a decrease in energy, feeling tired all the time, okay? Feeling like you usually were able to, go through your day fine, but then feeling like you want to take a nap or you want to go to bed early, feeling just worn out. So fatigue is another symptom. Another symptom for depression that we can utilize is feeling a lot of guilt, okay? Or a sense of worthlessness.
Yeah.
Feeling like even though you have a lot of accomplishments, it's hard for you to recognize, all the good stuff that you do, but it's very easy for you to just focus on what's negative or what you have done that's so bad. So
It's like nothing makes them happy.
correct.
Comes down to that self-worth, right?
Yes.
Yes.
Yeah, absolutely.
A lot of guilt and a lot of self-worth. And particularly in our culture, we're not very good at being,
Positive.
kind and nurturing to ourselves.
Right.
It's easier for us to be kind and nurturing to others, but when it comes to ourselves, we're very, strict, and we want to, no, everything must be perfect, and we'll talk about that later. Another symptom is a feeling that there is no hope for tomorrow. There's no change.
That's scary.
Today is horrible, tomorrow will be a repeat. So hopelessness, a sense of hopelessness, losing hope in everything around you, but also feeling helpless, like you're stuck in a corner, stuck in a rut, and you can't get out.
Yeah.
Right.
And there's no solution to the issues you're experiencing. You just can't see the light at the end of the tunnel.
Right.
Yeah.
Right.
And that's a very difficult.
That's very scary.
Yes,
and
very
sad.
scary.
And
serious.
one other symptom is having suicidal thoughts, thoughts about wishing you were never born, wishing that you were dead, wishing that, okay, I mean, sometimes people say, I just want to disappear. I don't want to be here anymore. And we have to be careful. So sometimes you can have passive thoughts, meaning like you're not thinking beyond that, where it's just a fleeting thought. It comes and it goes. It's not a good thing to have, but when it's progressing further, that's where it's like serious, and we have to start paying attention and seek help immediately.
Yes.
It's when someone starts to actively have plans. They ruminate and think about everything that's going wrong, and I don't want to be here, and you know what, I feel like I want to get up and do X, Y, and Z to hurt myself.
Yeah.
And is that like obvious to like either a spouse or a parent or a friend? Are they able to see that from the person that might be suffering from that? If they're I mean, how can you tell if they're planning, or is it like are they doing it on the open for attention, or is it more hidden and planned quietly?
I mean, that's a good question. If they're doing it for attention, then they might speak up about it.
Right.
Most of the time they keep it to themselves because they don't want others to
Very
stop
common,
them.
I think. I think it's more common that they keep it to themselves,
Right. So how do you recognize that?
It's
As a friend, as a parent,
I
as
guess
a
the other
spouse?
symptoms, right?
Yeah, the
Like you
other
just have to be in tune
symptoms.
to the other ones.
And you got to be in tune to what if you talk to them
Saying.
frequently,
Yeah.
kind of
Right.
maybe their
Scary.
words or their behavior.
Right. And with a child, we when a child is depressed already, and we know there's depression, and we're helping the child and treating the child, we encourage the parent to ask, to ask the child, regularly, do you ever have thoughts of wishing you were not here, not around, or things like that? And typically it doesn't mean that when you ask, you're going to plant those thoughts or ideas in the child's head. It's an extra precaution. You have to be aware to protect the person from themselves.
Right.
Another symptom is having low motivation to do things. So if you were motivated to get up and help your neighbor mow their lawn or something, and then after that you're like, no, I don't want to do this anymore, or motivated to spend an extra hour at work on your project or whatever it is, low motivation even to just do your daily things in life, that's a very common symptom as well of depression.
And how long does the low motivation have to last?
I'm like, isn't that a teenage thing though?
Yeah, because sometimes you go through times where you're not motivated to go to work or whatnot. How long does that low?
So for a major depressive episode, it lasts, you need to have the 5 symptoms for at least 2 weeks.
Well, and I think that's the key is like, just because I don't want to go to the
work.
gym or go to work doesn't mean that I'm depressed, but it's the 5 symptoms, which I
Yes,
think
you
is
need
very
5
key.
symptoms for at least 2
weeks.
2 weeks.
Yeah. So,
So if you have 4 for 2 weeks, then you would categorize as that something else. Would that be a different type of depression, or?
yeah, it wouldn't hit the criteria for a major depressive
see.
episode.
But probably something to watch, though, right?
Yeah,
like,
something
'cause
to
I'm
pay
like 4 out of
attention to.
5 for 2 weeks. I would.
Pretty close.
That's,
Yeah.
yeah.
So, of the major depressive disorder, those that of people who suffer from depression, how many are suffering? What's the percentage of people who suffer from this specific disorder?
The specific disorder, to tell you the
This
truth,
is the main one. The main type?
that's the main type. In general, it's about 7% of it's the prevalence in the U.S. population is 7%.
Right.
Oh, wow.
And I would say there's also a range. So the main range is 18 to 29 years old. And the peak age is around 20 years old, actually.
Wow.
Yeah.
That young. That's surprising to me.
So, can you tell us what the other types of depressive disorders there are?
So there is persistent depressive disorder. And this one, as the name specifies, it's more persistent. It could be ongoing for 2 years in an adult or a year in a child. And for us to diagnose that, we need depression plus 2 other symptoms.
So of the ones that you talked about,
Correct.
it's one
Yeah.
of those
Right.
two.
Okay.
Wow,
Yeah.
okay.
Very interesting.
So it's all you need is just 2 in depression.
Yes.
And
Over a long period of
over
time,
longer.
longer.
2
More
years.
persistent,
Yeah.
yeah, which is 2
So
years.
it's not 2 weeks, it's either 2 years or 1 year in
Correct.
a child.
Yes.
And is that due to a circumstance that's happened in their life, or is that again caused by other?
No,
No,
that
okay.
one is not related to. There is another kind of depression. It's called adjustment disorder, and that one pertains to a recent life event.
Okay.
You know, whether it's a death, marital discord, financial issues, loss of jobs, whatever. If there is one specific trigger, then we call it adjustment disorder.
Got it.
That's
okay.
so interesting. So in that situation, do you find that they resolve themselves? Like, let's say if it's caused by somebody who lost their job, let's say they get a job. Do you find that it resolves, or does it just depend on the situation?
I mean, if the trigger is removed, some people are able to move on. Otherwise, you can't really tell. Sometimes it differs from one person to the other depending on your coping skills, right?
That makes sense.
So if you have more social and family support, if you have more resilience to begin with, so you're able to recover easily. Some people who don't have that kind of support or resilience
Yeah.
may get stuck and may move on to a major depressive episode. Does that make sense?
Yeah, it makes
moves up.
sense. Yeah. So one can progress into the other one.
One can totally, get out of it. That makes sense. Yeah. That's very informative. Thank you so much. This was extremely insightful.
Very much.
Thank you,
Very
ladies.
educational. Very interesting. We have a lot more questions coming
Yes.
for you in episode 2,
go
episode 2
away.
and 3. So this concludes part 1 on depression with Dr. Sherry Girgis, and we'll see you next time on The Grapevine. Thank you.
Bye, everyone.
Bye.
Bye.